The idea that a doctor's touch brings healing is a comforting lie. Many believe these halls of sterile white are sanctuaries, but I've seen what lurks in the shadows between the beeping machines and the hushed pronouncements. A vision, dark and indelible, showed me the true nature of suffering, not as a disease to be cured, but as a hunger that feeds on the very souls sworn to mend it. This isn't about luck. It's about a cool pact that many in these professions are unknowingly fulfilling, a descent into a realm where the boundaries between life and the abyss blur into a single terrifying scream. I saw a nurse, her eyes hollowed like forgotten wells, meticulously charting vitals, but her hands, they moved with a grace that was not entirely her own, as if guided by unseen strings. The transcript speaks of ordinary shifts, but my visions reveal the extraordinary horrors that unfold when the veil thins. She was tending to a patient fading into the encroaching darkness, a patient whose pain was so profound it seemed to carve itself into the very fabric of the room. It wasn't just flesh and bone succumbing, it was something far more ancient, something that craved the light of life to extinguish it. But the truth is, the transcript mentions a doctor encountering a patient whose symptoms defied all logical explanation. He spent hours, days even, poring over charts, his brow furrowed in a desperate search for answers. Yet, the affliction persisted, a recalcitrant shadow clinging to the afflicted. In my visions, I saw this doctor not just searching for a diagnosis, but battling an intruder, a spectral entity that had attached itself to the patient, feeding on their vitality. The medical texts offered no solace, for they were written in a language of the tangible, blind to the spectral parasites that feast in the hidden corners of existence. Now, imagine this: a young intern, eager to prove herself, stayed late one night. The silence of the empty hospital was broken only by the rhythmic hum of machinery and the distant mournful sigh of the wind. She heard a faint scratching sound coming from within the walls. The transcript describes it as rats, a common enough nuisance, but the sound I heard in my vision was different. It was the sound of something gnawing, not at wood or plaster, but at the very essence of reality, a discordant symphony played by unseen claws. It was a prelude to a revelation that would shatter her naive perceptions forever. Listen carefully, because this is crucial. There's a story within the transcript about a surgeon, renowned for his steady hand, who began to experience tremors during operations. He attributed it to stress, to the immense pressure of his craft. But the tremors were not born of exhaustion. They were the echoes of a spectral touch. I saw him operating, and as his scalpel descended, a cold, ethereal hand pressed down alongside his, guiding the blade with chilling precision. This wasn't mere malpractice. It was a terrifying co-authorship, a dark symbiosis where the living hand was merely an extension of a malignant will. The transcript tells of a nurse who found an old, dusty medical journal tucked away in a forgotten locker. It spoke of treatments and remedies that were crude, almost barbaric by modern standards. But what it truly contained were incantations, whispered pleas to entities beyond human comprehension, seeking aid when conventional methods failed. This journal wasn't just a historical artifact. It was a grimoire of desperation, a testament to those who, in the face of overwhelming despair, turned their pleas not to science, but to the abyss, hoping for a response from the silent darkness. And this is where everything changes for you. The chilling account of a resident physician who started hearing voices, faint at first, then growing more insistent, urging him to perform unnecessary procedures. The transcript labels it as stress-induced auditory hallucinations. My visions, however, painted a different picture. He was not hallucinating, he was being commanded. The whispers were not his own thoughts unraveling, but the insidious directives of something ancient and malevolent, using his position to inflict suffering, to harvest despair like a farmer harvests a morbid crop. Consider the case of the night shift nurse who began to notice objects moving on their own. The transcript dismisses it as faulty equipment, or perhaps her own fatigue playing tricks on her mind. But the objects weren't just moving, they were being moved. I saw shadows coalesce in the periphery of her vision, thin, wraith-like figures, their forms indistinct, their purpose undeniably sinister. They were not mere poltergeists, they were the lost, the unseen, drawn to the nexus of pain and fear, manipulating the physical world with a chilling indifference to the living. What the stars don't tell you openly is, the transcript describes a doctor who felt a profound, unsettling coldness emanating from a particular patient, a coldness that seeped into his bones. This wasn't just hypothermia, it was the chill of the void itself. I witnessed this doctor trying to warm the patient, his own body growing frigid, as if he were touching not flesh, but the frozen breath of the grave. The life force was being siphoned, not just from the patient, but subtly, insidiously, from the healer himself, a creeping frost that promised an eternal winter. There was a story about a nurse who witnessed a patient, declared dead, suddenly gasp for air. The transcript calls it a rare phenomenon, a miscalculation of the vital signs. But the gasp wasn't a return to life. It was a soul's desperate attempt to cling to its vessel, a vessel that had already been claimed by something else. I saw the spectral fingers reaching, pulling, and the gasp was the final, terrified exhalation of a spirit being forced out, a struggle against the inevitable descent into the cold, dark earth. But the truth is, the transcript mentions a surgeon experiencing a persistent feeling of being watched, even when alone. He blamed the isolation, the long hours. However, the unseen eyes were not imagined. They belonged to the unborn, the spectral echoes of lives never fully realized, their pain a constant thrum in the ether. These entities are drawn to places where life teeters on the precipice, where the boundaries between what is and what could have been are most fragile. Their silent stares a palpable weight of despair. Imagine a young doctor, brimming with optimism, entering a particularly dilapidated ward. The air in that ward felt heavy, burdened with unspoken tragedies. The transcript might refer to poor ventilation or a lingering scent of decay. But what I perceived was the stench of suffering, a miasma of forgotten sorrows that clung to the very walls. It was a place where hope withered and died, leaving behind only the brittle husks of despair, a fertile ground for the shadows to breed. Listen carefully because this is crucial. The transcript discusses a nurse who felt an inexplicable urge to touch a particular patient's hand, an urge that felt alien and wrong. This was not compassion, it was an external compulsion. I saw her hand, guided by an invisible force, reaching out, her fingers brushing against the patient's skin, and in that touch, a minuscule spark of life, a flicker of vitality, was transferred, not to heal, but to consume. The darkness seeks conduits, and the empathetic heart can be its most potent weapon. Now, consider the story of a physician who began to see fleeting apparitions in his peripheral vision, figures that vanished when he turned to look directly. The transcript suggests fatigue or stress, but these were not figments of his imagination. They were fragments of other realities bleeding through. These were the lost souls, adrift in the liminal spaces, their presence a constant, chilling reminder of the fragility of existence and the vast unknown territories that lie just beyond our perception. And this is where everything changes for you. The transcript details a nurse who felt a phantom pain, a sharp, searing sensation in her own body that mirrored a patient's agony. This empathic resonance was not a gift, it was a malicious transference. I witnessed the pain not as a shared experience, but as a bleed-through from the other side, a spectral wound inflicted upon her through the very conduit of care she offered. The darkness doesn't just inflict pain, it projects it, using the living as its canvas. There was a chilling anecdote about a doctor who discovered old, dried blood stains on the floor of an unused operating room, stains that no amount of cleaning could completely eradicate. The transcript likely attributes this to prior incidents or poor maintenance. But this blood was more than residue. It was a sacrifice, a dark offering from a time when the hospital's foundations were laid upon something far older and more sinister than mere bricks and mortar. These stains whispered tales of rites performed in the dead of night. What the stars don't tell you openly is, the transcript mentions a resident who felt an overwhelming sense of dread whenever he entered a specific patient's room, a dread that seemed to emanate from the patient themselves. This was not fear of illness, it was the primal terror of the consumed. The patient was a beacon, radiating the chilling emptiness of their encroaching doom, a despair so profound it could be felt physically, a harbinger of the void that awaited them, and perhaps all of us. The narrative of a nurse who heard whispered promises of relief from a patient who was supposed to be unconscious is particularly disturbing. The transcript might suggest a patient waking briefly, or a sleep-talking phenomenon. But the promises were not born of pain relief. They were temptations from the darkness. The entity whispering through the patient offered a false peace, a fleeting respite in exchange for the patient's very soul. A grim bargain struck in the silent theater of suffering. But the truth is, the transcript recounts a doctor's unsettling experience of a patient's eyes following him around the room, even when their head was turned away. This was not a trick of the light. I saw those eyes, not merely following, but fixated, their gaze piercing through the veil of the physical. The patient was a vessel, and through those unnerving eyes, something ancient and predatory was observing, studying, perhaps even judging, the living world it could no longer inhabit. Consider the doctor who felt a sudden, inexplicable drop in temperature when examining a patient, a cold so profound it felt like death's touch. The transcript attributes this to atmospheric changes or the patient's condition, but this cold was a signature, the signature of an entity that had long since left the realm of warmth and life. It was the chilling embrace of the null, a fleeting glimpse into the absolute zero of existence that had briefly manifested through the afflicted body. Listen carefully because this is crucial. The story of a nurse who found a patient's belongings arranged in a specific, unsettling pattern after they had passed away is deeply disturbing. The transcript might suggest grief or a strange habit, but this pattern was a message, a final, macabre communication left by the departing soul, or perhaps by the entity that claimed it. It was a symbolic language spoken in the arrangement of objects, a narrative etched in the mundane, intended for eyes that could see beyond the veil. Now, imagine the intern who felt a spectral hand brush against hers as she reached for a chart. The transcript would dismiss this as static electricity or a draft, but it was a touch from beyond, a cold, intangible caress that sent shivers down her spine. This touch was not accidental. It was an intrusion, a deliberate act by something that existed in the spaces between, testing the boundaries, seeking to establish a connection with the living world. And this is where everything changes for you. The chilling account of a physician who discovered an old, rusted surgical instrument in a patient's wound, an instrument that bore no resemblance to anything modern. The transcript might call it an accidental inclusion or a bizarre medical anomaly, but this instrument was a relic, a tool used in forgotten rites, a dark artifact that had been deliberately placed, a harbinger of a darkness that predated modern medicine, a darkness that still lingered, seeking to reclaim its dominion. There's a disturbing narrative about a nurse who heard her name being whispered from an empty bed, a soft, sibilant sound that seemed to emanate from the very mattress. The transcript might suggest the wind or a ventilation system, but the whisper was personal, a targeted call from the shadows. It was the dark, unseen world reaching out, attempting attempting to lure her, to draw her attention away from the tangible, into the realm of the spectral, where such whispers hold true power. What the stars don't tell you openly is, the transcript describes a doctor who felt an overwhelming sense of despair wash over him while examining a patient, a despair that wasn't his own. This was not empathy, it was eye infection. The patient was a vessel for a profound, soul-crushing sorrow, a sorrow so potent that it could spread like a plague, infecting the minds and spirits of those who drew too near. A testament to the shared weight of human suffering. The story of a nurse who found a patient's personal diary filled with disturbing, almost prophetic entries that seemed to predict their own demise, is particularly haunting. The transcript might suggest a person with a vivid imagination or a premonition, but these entries were not mere writings. They were incantations, a desperate attempt by the patient to ward off the darkness, or perhaps to communicate with it, a ritual of words that blurred the line between life and the inevitable, chilling finality of death. But the truth is, the transcript recounts a surgeon's experience of feeling an unseen force pressing down on his chest during a surgery, making it difficult to breathe. This was not anxiety, it was suppression. An entity, drawn to the intense focus and vulnerability of the operating room, was asserting its presence, attempting to interfere, to impede the delicate dance of life and death that unfolded on the table, a silent saboteur in the theater of healing. Consider the doctor who felt a phantom touch on his arm, a cold, dry caress that lingered long after the patient was gone. The transcript would dismiss this as nerve endings misfiring or psychosomatic, but this touch was a brand, a mark left by something that had briefly brushed against the veil, leaving behind a faint spectral residue, a chilling reminder of the unseen forces that brushed past us in the quiet moments. Listen carefully because this is crucial. The narrative of a nurse who heard the faint sound of crying coming from a closet where no one was present is deeply unsettling. The transcript might suggest faulty pipes or echoes, but the crying was not a sound of distress. It was a wail of the lost, the spectral lament of souls trapped between worlds, their sorrow echoing through the hollow spaces of the hospital, a constant, mournful reminder of their eternal purgatory. Now imagine a young doctor feeling an overwhelming urge to look at a particular spot on the ceiling, an urge that felt compulsive and unnatural. The transcript might attribute this to fatigue or a stray thought, but this compulsion was orchestrated. Something in the unseen realm was directing his gaze, perhaps to observe something hidden, something that existed only in the warped dimensions of the spectral. A silent, invisible theater playing out above. And this is where everything changes for you. The chilling story of a physician who discovered an old photograph tucked inside a patient's medical file. A photograph that seemed to depict the patient many decades prior, looking impossibly old. The transcript would call this an error, or a confusing artifact. But this photograph was a window, a glimpse into a temporal anomaly. A hint that the patient's existence was not confined to the linear progression of time, but perhaps stretched into shadowed epochs. There's a disturbing account of a nurse who felt a sudden intense dread emanating from a completely empty examination room, a dread that clung to her like a shroud. The transcript might suggest a prior traumatic event associated with the room, but this dread was a residue, the lingering psychic imprint of something truly horrific that had occurred there, something so potent that its terror continued to permeate the very air, a silent, invisible testament to its passage. What the stars don't tell you openly is, the transcript mentions a doctor who heard faint, disembodied laughter while performing an autopsy, laughter that was cold and devoid of mirth. The transcript would attribute this to stress, or the grim nature of the work, but this laughter was not human. It was the chuckle of the void, the sound of entities that find amusement in the cessation of life, their mirth, a chilling chilling echo from the other side of existence, a commentary on the ultimate futility of it all. The story of a nurse who felt a phantom itch on her skin, a sensation that persisted even after vigorous scratching, is particularly unnerving. The transcript would dismiss it as a psychosomatic response or an allergic reaction, but this itch was a transmission, a spectral infestation, a faint echo of a parasitic entity's presence, a chilling reminder that sometimes the unseen world leaves its physical imprint on the living. But the truth is, the transcript recounts a surgeon's experience of feeling a sudden paralyzing fear grip him as he entered a patient's room, a fear that felt primal and unwarranted. This was not apprehension about the surgery, it was the instinctual terror of prey encountering a predator, a primal alarm bell ringing in his subconscious, warning him of a danger that existed far beyond the scope of his medical training. Consider the doctor who saw a fleeting shadow detach itself from a patient's body and disappear into the wall. The transcript would dismiss this as an illusion or a trick of the light, but this shadow was a departure, the spectral essence of the patient, or something that had inhabited them, finally detaching, slipping through the cracks in reality, a tangible manifestation of a soul's transition, or perhaps its abandonment. Listen carefully because this is crucial. The narrative of a nurse who felt a sudden intense wave of sadness coming from a seemingly healthy patient is deeply profound. The transcript might suggest empathy or a hidden personal struggle, but this sadness was a bleeding, a leakage of profound despair from the patient's inner world, a sorrow so deep it could manifest physically, a silent testament to an unseen soul-crushing burden they carried. Now imagine a young nurse feeling an inexplicable urge to write down a patient's name repeatedly on a notepad, an urge that felt outside of her control. The transcript might suggest obsessive thoughts or stress, but this urge was manifested, a spectral entity attempting to etch its presence into the tangible world, using the nurse as its unwitting scribe, a dark sigil drawn by an unseen hand upon the parchment of the living. And this is where everything changes for you. The chilling account of a physician who discovered an old, tattered piece of cloth clutched tightly in a deceased patient's hand, a cloth that seemed to vibrate with a faint residual energy. The transcript would attribute this to the patient's last moments, or a sentimental object, but this cloth was a talisman, imbued with energies from the other side, a conduit through which a spirit attempted its final desperate communication, a silent plea or a warning whispered through its very fibers. There's a disturbing narrative about a nurse who heard a faint raspy voice whispering what sounded like medical advice from an empty IV bag. The transcript would dismiss this as auditory hallucination or a draft, but the voice was an intruder, a disembodied intelligence using the mundane objects of the hospital as its mouthpiece, attempting to influence the care of the living, a spectral diagnostician offering its chilling, unsolicited counsel. What the stars don't tell you openly is, the transcript mentions a doctor who felt a profound sense of unease whenever he heard a specific recurring musical melody, a melody that seemed to evoke a sense of ancient dread. The transcript might suggest a personal association or a common tune, but this melody was a call, a siren song from the spectral realm, a resonant frequency that vibrated with the despair of forgotten souls, a tune that beckoned the unwary into the abyss. The story of a nurse who found a patient's reflection in a window appearing distorted and monstrous, even though the patient themselves was calm, is truly terrifying. The transcript would attribute this to the glass, the lighting, or fatigue, but the distortion was a revelation, a glimpse behind the mask, revealing the true, horrifying form of what lay beneath the surface, a fleeting image of the darkness that can fester within the human soul. But the truth is, the transcript recounts a surgeon's experience of feeling a phantom breath on the back of his neck during a night shift, a breath that was icy cold and carried the faint scent of decay. This was not the wind. It was the presence of something that lingered in the quiet hours, something that fed on the vulnerability of those who worked while the world slept, its cold breath a constant reminder of its unseen predatory watch. Consider the doctor who saw a small dark object roll out from under a patient's bed, an object that seemed to absorb the light around it. The transcript would dismiss this as a dropped item or a toy. But this object was a void, a fragment of concentrated darkness, drawn to the emanations of sickness and suffering, a tangible piece of the abyss that had momentarily manifested in the realm of the living. Listen carefully, because this is crucial. The narrative of a nurse who felt a sudden, intense burning sensation on her hand, a sensation that vanished as quickly as it appeared, leaving no mark. The transcript might suggest friction or a momentary contact, but this burning was a branding, a spectral mark left by something that had briefly touched her, a fleeting imprint of otherworldly heat, a chilling reminder that the unseen world can leave its fiery signature upon the flesh. Now imagine a young physician feeling an overwhelming sense of being judged, as if unseen eyes were scrutinizing his every move during a patient examination. The transcript would attribute this to performance anxiety or self-consciousness, but this judgment was external, the silent, impassive appraisal of entities from beyond, entities that observed the struggling efforts of humanity with a detached, perhaps even cruel, curiosity, their scrutiny a weight upon the soul. And this is where everything changes for you. The chilling account of a doctor who discovered an old, faded tattoo on a patient's skin, a tattoo that seemed to depict an ancient, unsettling symbol that he couldn't identify. The transcript would call this a personal marking, or an artistic choice. But this tattoo was a sigil, a mark of allegiance to something ancient and forbidden, a symbol that resonated with forgotten powers, hinting at a deeper, darker connection that transcended the patient's current existence. There's a disturbing narrative about a nurse who heard a faint, rhythmic tapping coming from inside a sealed medical waste bin, a tapping that seemed to grow more insistent. The transcript would dismiss this as settling materials or a hallucination. But the tapping was a signal, a desperate attempt by something trapped within, or perhaps something seeking entry, to communicate its presence, a percussive plea echoing from the darkness of containment. What the stars don't tell you openly is, the transcript mentions a doctor who felt a sudden intense wave of nausea and dizziness when entering a specific room, a room that appeared perfectly normal. The transcript might suggest environmental factors or a personal sensitivity, but this physical reaction was a warning, a visceral response from his body to an unseen presence, a psychic alarm bell signaling a profound disturbance in the very fabric of that space. The story of a nurse who found a patient's bedclothes neatly folded, as if by unseen hands, after they had passed away, is particularly unsettling. The transcript would attribute this to hospital staff or a misunderstanding, but the folding was a ritual, a posthumous act of tidiness performed by something that lingered, perhaps a spirit seeking to bring order to chaos, or a darker entity imposing its own strange, silent decree upon the remnants of life. But the truth is, the transcript recounts a surgeon's experience of seeing a fleeting, shadowy figure moving in the corner of his eye as he worked late in the empty operating theater. A figure that vanished when he turned. The transcript would dismiss this as fatigue or an overactive imagination, but the figure was a specter, a residual presence drawn to the intense energies of life and death that permeated the room, a silent observer from the spectral plane, its movements a chilling dance in the periphery of perception. Consider the doctor who felt a sudden sharp pain in his hand, as if he had pricked himself with a needle, only to find no mark or wound. The transcript would dismiss this as a phantom sensation or a minor injury, but the pain was a transmission, a spectral injection, a fleeting sting from an unseen instrument, a chilling reminder that the unseen world can inflict its physical sensations upon the living without leaving a trace. Listen carefully because this is crucial. The narrative of a nurse who heard a faint, distorted whisper, almost like a distorted plea, coming from a seemingly ordinary wall outlet is deeply disturbing. The transcript might suggest electrical interference or echoes, but the whisper was a conduit, a disembodied voice attempting to breach the barrier between worlds, using the mundane infrastructure of the hospital as its strange technological portal to reach the ears of the living. Now, imagine a young physician feeling an inexplicable urge to touch a specific part of a patient's body, an urge that felt both compelling and wrong. The transcript would attribute this to an unconscious diagnostic impulse or curiosity, but this urge was initiated, a spectral hand guiding his own, seeking to make contact, to channel an unseen energy, or perhaps to plant a subtle spectral seed of influence through that forbidden touch. And this is where everything changes for you. The chilling account of a doctor who discovered an old, tarnished locket hidden within a patient's personal effects, a locket that, when opened, revealed a miniature, unsettling portrait that seemed to watch him. The transcript would call this a keepsake or a strange artifact, but the locket was a vessel, a repository for a lingering spirit, its contents a focal point for an unseen presence that sought observation, its portrait a window into a soul that refused to fade into oblivion. There's a disturbing narrative about a nurse who heard a faint scratching sound emanating from beneath the floorboards of a patient's room, a sound that continued intermittently throughout the night. The transcript would dismiss this as rodents or structural settling, but the scratching was an attempt, a desperate effort by something confined below to claw its way into the realm of the living, a persistent, unnerving sound that spoke of confinement and a relentless desire for freedom. What the stars don't tell you openly is the transcript mentions a doctor who felt a sudden intense cold spot in the room, a cold that was localized and seemed to follow him, chilling him to the bone. The transcript might suggest drafts or a malfunctioning HVAC system, but this cold was a signature, the spectral chill of an entity that had passed through, leaving behind a palpable imprint of its passage, a fleeting testament to its unearthly nature. The story of a nurse who found a patient's handwriting in their chart, subtly changing, becoming more erratic and archaic over time, is truly unnerving. The transcript would attribute this to the patient's deteriorating condition or medication, but the change was an influence, a gradual takeover, a subtle alteration of the patient's very essence, as if an ancient alien consciousness was slowly rewriting the narrative of their life, one letter at a time. But the truth is, the transcript recounts a surgeon's experience of feeling a phantom weight on his arm during a procedure, as if someone were leaning on him, a weight that offered no physical resistance but was undeniably present. The transcript would dismiss this as fatigue or pressure, but the weight was a presence, the subtle, yet undeniable, imposition of an unseen entity, a spectral companion seeking to share in the critical moments of life and death, its unseen form a chilling collaboration. Consider the doctor who saw a fleeting glimpse of a skeletal hand reaching out from beneath a patient's hospital gown, only to see it vanish when he looked closer. The transcript would dismiss this as an illusion or a hallucination, but the hand was a harbinger, a stark visual manifestation of the patient's mortality, a spectral reminder of the inevitable decay that awaited them, a chilling omen delivered from the other side of the veil. Listen carefully because this is crucial. The narrative of a nurse who heard a faint melancholic humming coming from an empty storage closet is deeply unsettling. The transcript might suggest pipes or ventilation, but the humming was a lament, a spectral song of sorrow sung by a soul trapped in the forgotten spaces, its melody a mournful echo of regret and longing, a chilling soundtrack to the forgotten corners of existence. Now, imagine a young physician feeling an overwhelming sense of being pulled towards a specific darkened corner of a room, an urge that felt both involuntary and insistent. The transcript would attribute this to curiosity or a misplaced object, but the pull was an invitation, a spectral beckoning from something hidden in the shadows, seeking to draw him into its unseen domain, a silent summons into the unknown depths. And this is where everything changes for you. The chilling account of a doctor who discovered an old, discolored key in a deceased patient's pocket, a key that seemed to fit no lock in the hospital. The transcript would call this a personal belonging or a meaningless object, but the key was a passage, a symbol of access to a hidden reality, a gateway to unseen doors and forgotten places, a tangible artifact of a spectral journey that the patient had perhaps undertaken. There's a disturbing narrative about a nurse who heard a faint, sibilant whisper of a name, not her own, coming from the empty space beside a patient's bed. The transcript would dismiss this as the wind or auditory hallucination, but the whisper was a call, a spectral summons directed at something unseen, a communication from the other side, a chilling acknowledgement of a presence that existed just beyond the visible spectrum. What the stars don't tell you openly is, the transcript mentions a doctor who felt a sudden intense vibration emanating from a patient's body, a vibration that seemed to hum with an unnatural energy. The transcript might suggest muscle spasms or equipment interference, but this vibration was a manifestation, a sign of an entity trying to break free, or perhaps to communicate through the patient's very being, a percussive pulse from the spectral realm resonating within the physical. The story of a nurse who found a patient's belongings rearranged in a deliberate, almost accusatory pattern after their death is profoundly disturbing. The transcript would attribute this to grief, or a strange habit, but the arrangement was a judgment, a final silent indictment left by the departed, or perhaps by the forces that claimed them, a symbolic language spoken in the placement of objects, a narrative of blame etched in the mundane. But the truth is, the transcript recounts a surgeon's experience of feeling a phantom coldness in the operating room, a coldness that seemed to settle on the instruments themselves, making them feel unnaturally frigid. The transcript would dismiss this as temperature fluctuations, but the cold was an imprint, the lingering touch of spectral entities drawn to the raw energies of the theater of life and death, their frigid presence chilling the very tools of healing. Consider the doctor, who saw a faint, shimmering outline of a figure standing by a patient's bed, an outline that pulsed with an unearthly light before fading. The transcript would dismiss this as an illusion, or a trick of the light, but the outline was a transcendent, a being from another dimension, briefly intersecting with ours, its form a visual manifestation of its fleeting passage through the veil, a ghost of a ghost. Listen carefully, because this is crucial. The narrative of a nurse who heard a faint, guttural growl coming from a seemingly empty medication cart is deeply unsettling. The transcript might suggest pipes or echoes, but the growl was a warning, a primal sound of aggression from something that lurked in the shadows, a territorial sound from an unseen creature that saw the hospital's hidden spaces as its own domain. Now, imagine a young physician feeling an overwhelming sense of being observed by something unseen and ancient, an observation that felt both invasive and judgmental. The transcript would attribute this to stress or paranoia, but the observation was a scrutiny, the cold, detached appraisal of entities that exist beyond human comprehension, their ancient gaze piercing through the veil, assessing the fragile existence of humanity with an unnerving intensity. And this is where everything changes for you. The chilling account of a doctor who discovered an old, intricately carved wooden box hidden within a patient's belongings, a box that, when opened, emitted a faint, chilling wind. The transcript would call this an antique or a curiosity, But the box was a container, a vessel holding not just air, but the exhaled breath of the spectral realm, a chilling artifact that brought a fragment of the other side into the tangible world, its wind a whisper from the abyss. There's a disturbing narrative about a nurse who heard a faint, rhythmic dripping sound coming from an entirely dry ceiling tile. The transcript would dismiss this as echoes or a hallucination, but the dripping was a tear, the spectral manifestation of unseen sorrow, the silent weeping of a soul trapped in despair, its phantom tears falling from an unseen source, a chilling testament to eternal grief. What the stars don't tell you openly is, the transcript mentions a doctor who felt a sudden, intense desire to harm a patient, an urge that felt entirely alien and violent. The transcript would attribute this to extreme stress or mental instability, but the urge was an implantation, a malevolent thought planted by an external force, a spectral entity seeking to corrupt and control, using the doctor as its unwitting instrument of dark intent. The story of a nurse who found a patient's shadow appearing to move independently on the wall, detached from their body, is profoundly disturbing. The transcript would attribute this to lighting, or an optical illusion, but the shadow was a separation, a visual manifestation of a soul struggling to remain tethered, or perhaps, of something dark, attempting to sever the connection, a chilling visual metaphor for a spirit's fracturing grip on existence. But the truth is, the transcript recounts a surgeon's experience of feeling a phantom pressure on his hand, as if an invisible glove were being placed upon it, a sensation that was both chilling and constricting. The transcript would dismiss this as a phantom limb sensation or nerve issues, but the pressure was a confinement, a spectral restraint, an unseen force attempting to bind his movements, perhaps to impede his actions, or to assert its own chilling dominance over the surgical domain. Consider the doctor, who saw a faint, almost imperceptible outline of a skeletal face superimposed over a patient's reflection in a darkened window. The transcript would dismiss this as pareidolia, or a trick of the light, but the face was a revelation, a chilling glimpse into the skeletal truth beneath the flesh, a spectral memento mori delivered from the other side, a stark reminder of the inevitable fate that awaits all living beings. Listen carefully, because this is crucial. The narrative of a nurse who heard a faint, static-like buzzing coming from an empty computer monitor is deeply unsettling. The transcript might suggest electrical issues or background noise, but the buzzing was a transmission, a signal from the digital ether, a sign that the unseen world was attempting to communicate through the very technology meant to connect us, a chilling harbinger of spectral data streams. Now, imagine a young physician feeling an overwhelming sense of being watched by something that felt both ancient and hungry, an observation that sent shivers down his spine. The transcript would attribute this to anxiety or an overactive imagination, but the observation was a predation, the keen, anticipatory gaze of something that fed on fear and vulnerability, its unseen eyes fixed upon the susceptible living, waiting for its moment to strike. And this is where everything changes for you. The chilling account of a doctor who discovered an old, leather-bound book filled with unsettling hand-drawn anatomical diagrams that seemed impossible, diagrams depicting beings not of this world. The transcript would call this a medical text or an artist's work, but the book was a grimoire, a forbidden text detailing the unholy architecture of alien life, a dark testament to anatomies that defy natural law, a glimpse into the horrifying possibilities that lie beyond our known biological parameters. There's a disturbing narrative about a nurse who heard a faint, whispering chorus of voices coming from an empty supply closet, voices that seemed to chant in an unknown guttural language. The transcript would dismiss this as echoes or imagination, but the chorus was a convocation, a gathering of spectral entities performing an ancient alien ritual, their unknown tongues weaving a tapestry of dark energy, a chilling symphony of the damned. What the stars don't tell you openly is, the transcript mentions a doctor who felt a sudden, intense surge of malevolent energy emanating from a patient who appeared outwardly calm. The transcript might suggest a hidden illness or psychological distress, but the energy was a malignancy, a palpable wave of pure, unadulterated evil radiating from a soul that had become a conduit for something truly sinister, a dark force that sought to poison the very air around it. The story of a nurse who found a patient's favorite pillow arranged in a peculiar ritualistic manner after their passing is profoundly disturbing. The transcript would attribute this to grief or a peculiar habit, but the arrangement was a symbol, a final, silent communication, perhaps a marker for a spiritual transition, or a subtle offering to the unseen forces that had claimed the patient, a testament to a final, unknown pact. But the truth is, the transcript recounts a surgeon's experience of feeling a phantom chill on his skin, a chill that seemed to emanate from the surgical lights themselves, making the operating room feel unnaturally cold. The transcript would dismiss this as temperature fluctuations, but the chill was an incursion, the spectral touch of entities drawn to the intense energy of the operating theater, their frigid essence permeating the artificial light, a chilling reminder of their constant unseen vigil. Consider the doctor, who saw a faint, dark stain on the floor that seemed to spread and recede like a living thing, a stain that no amount of cleaning could remove. The transcript would dismiss this as a persistent mark or a chemical reaction, but the stain was a progeny, a living manifestation of spilled darkness, a fragment of the abyss that had taken root, its subtle movements, a chilling testament to its unnatural burgeoning existence. Listen carefully because this is crucial. The narrative of a nurse who heard a faint rhythmic scraping sound coming from inside a sealed examination glove is deeply unsettling. The transcript might suggest trapped air or material settling, but the scraping was an effort, a desperate attempt by something unseen to break free from its confines, a chilling sound of struggle from within the mundane, a testament to the hidden struggles that occur just beyond our perception. Now, imagine a young physician feeling an overwhelming sense of being guided by an unseen hand towards a particular piece of medical equipment, an urge that felt both compelling and intrusive. The transcript would attribute this to diagnostic intuition or habit, but the guidance was external, a spectral manipulation of his actions, an unseen force subtly directing his path, using him as a tool to interact with the physical world in ways it could not achieve alone. And this is where everything changes for you. The chilling account of a doctor who discovered an old, tarnished mirror fragment tucked within a patient's chart, a fragment that, when angled, seemed to show a distorted, horrifying reflection of the room. The transcript would call this an oddity or a broken object, but the mirror was a gateway, a fractured portal to a reality where reflections held monstrous truths, a sliver of the abyss that offered a glimpse into the warped and terrifying dimensions that lie just beyond our own. There's a disturbing narrative about a nurse who heard a faint, mournful sigh coming from an empty ventilator tubing. The transcript would dismiss this as airflow or a malfunction, but the sigh was a spirit, the exhalation of a soul clinging to its last vestiges, or perhaps the first breath of something new, entering the world of the unseen, a chilling release of energy from the threshold of existence. What the stars don't tell you openly is, the transcript mentions a doctor who felt a sudden intense feeling of being physically pushed by an unseen force, an invisible shove that almost sent him stumbling. The transcript might attribute this to a strong draft or a loss of balance, but the push was an aggression, a direct spectral assault, a chilling demonstration of otherworldly power, a clear message that the unseen world could assert its physical dominance when it chose to. The story of a nurse who found a patient's belongings, a arranged in a circle around their deathbed after they had passed, is profoundly disturbing. The transcript would attribute this to grief, or a final act of comfort. But the circle was a boundary, a spiritual demarcation, perhaps to contain a lingering entity, or to facilitate a passage, a silent, symbolic act performed by unseen hands for purposes unknown, a chilling cosmic ritual. But the truth is, the transcript recounts a surgeon's experience of feeling a phantom warmth on his hand, a warmth that felt intensely out of place in the sterile environment, a warmth that seemed to pulse with a faint, unearthly energy. The transcript would dismiss this as residual heat or nerve stimulation, but the warmth was a connection, a spectral touch, a fleeting bridge between the living and the dead, a chilling intimacy offered by something that had long since lost its own corporeal heat. Consider the doctor who saw a faint, dark smudge on his stethoscope that seemed to expand and contract with a slow, organic rhythm. The transcript would dismiss this as residue or a stain, but the smudge was a sentience, a nascent consciousness, a fragment of the unseen world that had briefly adhered to the instrument of diagnosis, its subtle rhythm, a chilling pulse of alien life. Listen carefully because this is crucial. The narrative of a nurse who heard a faint, guttural clicking sound coming from inside a sealed sharps container is deeply unsettling. The transcript might suggest plastic settling or trapped air, but the clicking was a communication, a percussive language spoken by something contained, or perhaps attempting to escape, its alien rhythm, a chilling attempt to make its presence known from within the sterile confines. Now, imagine a young physician feeling an overwhelming sense of being drawn towards a specific shadowed corner of the hospital corridor, an attraction that felt both magnetic and terrifying. The transcript would attribute this to curiosity, or a misplaced item, but the draw was a summons, a spectral beckoning from the darkness, an unseen force pulling him towards an unknown encounter, a silent invitation into the heart of the abyss. And this is where everything changes for you. The chilling account of a doctor who discovered an old, dog-eared map tucked inside a patient's medical file, a map depicting the hospital grounds with strange, anomalous markings. The transcript would call this an old blueprint, or a curious addition, but the map was a guide, a cartography of the unseen, marking pathways and points of interest within the spectral geography of the hospital, a guide to the hidden dimensions that coexist with our own. There's a disturbing narrative about a nurse who heard a faint, metallic scraping sound coming from inside a sealed biohazard bag. The transcript would dismiss this as material settling, or trapped air, but the scraping was an escape, a desperate effort to break through the barrier, a chilling testament to something trying to get out from its contained fate, its unseen struggle echoing from within the sterile darkness. What the stars don't tell you openly is, the transcript mentions a doctor who felt a sudden, intense wave of claustrophobia while examining a patient, a feeling of being trapped that seemed to emanate from the patient themselves. The transcript might suggest a psychological transference, but the claustrophobia was a manifestation, a psychic projection of a confined entity, a spectral being trapped within the patient's aura, its desperate struggle for space radiating outward, infusing the room with its suffocating dread. The story of a nurse who found a patient's personal items arranged in a spiral pattern on their bedside table after their death is profoundly disturbing. The transcript would attribute this to grief, or a strange habit, but the spiral was a symbol, a representation of descent or ascension, a cosmic pathway, or perhaps a containment field, a chilling arrangement of earthly objects hinting at a journey into unseen realms, or a binding to something ancient and dark. But the truth is, the transcript recounts a surgeon's experience of feeling a phantom whisper of his name, spoken in a distorted, chilling voice, coming from the empty space above the operating table. The The transcript would dismiss this as auditory hallucination or echoes, but the whisper was a claim, a spectral acknowledgement from something that observed, a chilling claim staked upon his presence, a dark familiarity spoken from the abyss, a sign that the unseen world recognized him. Consider the doctor who saw a faint, dark handprint appear, and then slowly fade on a clean glass surface. The transcript would dismiss this as condensation or a smudge, but the handprint was a visitation, a tangible mark left by an ethereal presence, a chilling imprint of a spectral touch, a silent testament to the fact that the unseen can, and sometimes does, leave its mark upon the physical world. Listen carefully because this is crucial. The narrative of a nurse who heard a faint, rhythmic tapping coming from inside a sealed sharps container, a tapping that seemed to grow more insistent, is deeply unsettling. The transcript might suggest plastic settling or trapped air, but the tapping was a code, a desperate percussive language from within the containment, a chilling attempt to communicate a message from the abyss, a rhythm that spoke of confinement and a desperate plea. Now imagine a young physician feeling an overwhelming sense of being drawn towards a specific darkened corner of the hospital corridor, an attraction that felt both magnetic and terrifying. The transcript would attribute this to curiosity or a misplaced item, but the draw was a summons, a spectral beckoning from the darkness, an unseen force pulling him towards an unknown encounter, a silent invitation into the heart of the abyss. And this is where everything changes for you. The chilling account of a doctor who discovered an old, dog-eared map tucked inside a patient's medical file, a map depicting the hospital grounds with strange, anomalous markings. The transcript would call this an old blueprint or a curious addition, but the map was a guide, a cartography of the unseen, marking pathways and points of interest within the spectral geography of the hospital, a guide to the hidden dimensions that coexist with our own. Do you feel these chilling echoes were meant for your ears? Share your disquiet in the comments below. Every soul that joins feeds the voice that whispers from the darkness. Subscribe and like, for the shadows welcome all who dare to listen.